Hello everybody, this is Jason Barger, and I'm sitting here with my good friend, Dr. Chip Shoba, who serves as the Dean of the Dartmouth Medical School and also VP of Health Affairs at Dartmouth College. And this step back from the baggage claim movement continues to spread in exciting ways throughout many different organizations. And one of the arenas that it is now moving into is this wider healthcare discussion. And so Chip and I met along the way and now have become good friends and are exploring what this spirit means for this wider healthcare discussion. And Chip, I remember on one of the first times we met each other when you made the phrase that the step back from the baggage claim spirit and leadership message was exactly what was needed in the midst of this wider healthcare discussion. Would you say something about that?
Sure. Thanks, Jason. It's great to be here with you. So the step back metaphor worked for me because we need to step back from the baggage claim of healthcare. I think there's no doubt that the healthcare system as we know it needs a lot of work. It's not working for enough people. But it occurs to me that our attempt to fix it is frenetic. It's like a rat race, crazy. You know the stories: 8-hour wait in the doctor's office, 12-hour wait in the emergency room. My bill makes no sense. So taking a moment to step back from this craziness and ask, what kind of healthcare system do we want to have?
Yeah.
I think is a very sensible way to begin.
Yeah, and I know as we have been talking about this now further that this idea of the ministry of availability, and in the book I talk about that phrase and talk about then what does it mean for us to infuse that care into healthcare. I mean, obviously it's always been in there, but into the future, what is it going to mean for us to keep care at the heart of healthcare?
Yeah. So I think this is one of our struggles, right? And it certainly flies in the face of the ethical foundation of medicine, strongly anchored in the Hippocratic Oath, which says, we value service above reward. And we find ourselves today in a healthcare environment where reward is often placed above service. That ministry of care that you talked about is not as front and present, I think, as patients and other constituents would like it to be. How do we get that, again, front and center? Big challenge.
Yeah, yeah. Well, I know what you and I have talked about is that we want to be a part of then solutions into the future, and that, how do we move forward, and what role is creativity, is innovation? How do we begin to move into a new future? And I know you and I are excited about creating a new future. So what would you say about now taking an old system and infusing it with some creativity and innovation?
Yeah, so it kind of reminds me of the Einstein quote, right?
Yeah.
Insanity is doing the same thing over and over again and expecting a different result.
Yeah.
And we've been doing pretty much the same thing over and over again, and not surprising, we're getting pretty much the same results.
Right.
So on the innovation side, we need radical change in healthcare delivery. The way we deliver care today is not sustainable. That care needs to move out from the hospital, not just into the doctor's office, but into the patient's home, and we have the technology to do that.
Yeah.
The payment structure is perverse, quite frankly, and as are the incentives. Now, those are big radical changes, right? And they are going to require that we change. Most people that I talk to about change say, oh, change is great, love to change, but then when they have to change, it's a different ballgame.
Right, right. Well, and that word change is right on the front of the book cover of Step Back from the Baggage Claim. Right on the front of that is the phrase, change the world. Yeah. And I know as you and I go around, we speak to a whole lot of different groups, and all kinds of organizations, a lot of the feedback that I get from people is, yeah, I want to be a part of changing the world, but that's a pretty daunting and somewhat overwhelming thing, especially when you talk about a very complex healthcare system that already does have a whole lot of great people in it working hard. How is it that then we actually do begin to change that system?
Right. So, you start making changes right where you are. Because we can change the world together, right?
Yep.
You win as a team.
Yep.
That applies to sports, but that applies to medicine. We will win as a team. So there are gigantic opportunities for each of us in our own little space that we tend to inhabit on a daily basis to make a difference.
Yeah.
We got to get people away from this notion that the only people who exercise leadership are those people who walk around with a big L branded on their forehead.
Right.
Because most of the leadership that happens in our world are these little acts of leadership. Leadership with a small L.
Yeah.
And there are hundreds and thousands of them that you can identify in the organization every day. A smile, a thank you, a going out of your way to help somebody. Those things add up, you see, and they generate cumulative momentum.
Yeah.
That's what makes a difference.
Yeah. Well, it's exciting because there are a lot of people beginning to make those small L stands within the world of healthcare, and it's exciting to see this step back from the baggage claim spirit and this movement, this leadership movement that does, in fact, as you say, start with each one of us, for us to cast down our bucket where we are and begin to put those actions into motion. It is beginning to change, and this is just the beginning of a much longer conversation. And we hope that you'll join the movement, learn more about Step Back from the Baggage Claim at stepbackfromthebaggageclaim.com, and be a part of infusing this leadership spirit into this healthcare discussion. Good to be with you.
Good to be with you, Jason.